Hello. Hey, y'all. All right. Okay. So today is Wednesday. Happy Wednesday, y'all. Happy Wednesday. Today is another episode to do. We're doing another episode of RX Info on the Go. And I am your host, Dr. Ravin Milton, PharmD. And I'm just coming to you today to give you some information on some of the supplements, products, medications, pharmacy related things that you never knew you needed to know. So, um, I'm going to take the opportunity to like, tag, and share, and I'm going to ask that you do so as well. If you could please do me a favor of like, tagging, and sharing. I'm going to take just a minute to hit that at followers on my page. If you could do at followers, at highlight, to really get this information out there, I'd appreciate it. Um, I would absolutely appreciate it. So I am going to get started because I'm already running just a tad bit late, y'all. But we're going to get it together. As you can see, I have my little coat on today. I'm coming in professional mode. I got my little Dr. Raven PharmD logo on. And as you can see, I am ready to go. So here we go. We are talking about bitter orange today. Let's talk about bitter orange. Does anybody know what bitter orange is? Have you ever heard of it? I hope you have. If you haven't, I'm going to give you just a little bit of information today, not a whole lot. Um, but I'm going to come right out the gate with the one little thing about bitter orange. There is nothing and absolutely nothing that has been proven study wise that this actually works. So just want to give you, that heads up that before we start anything, that bitter orange, yes, it's a supplement. Yes, it's something that's available on the market. Has it been proven in studies that this supplement actually works for certain things? No, but just keep in mind that FDA doesn't always test everything that is a supplement. So we're going to start off there. So here we go. Bitter orange. It is it actually comes from a fruit bearing tree that is native to Southeast Asia. Now, bitter orange is typically too sour to eat raw, but the peels, the fruit, and the oils that come from the peel actually provide different types of properties. Can be used to cook with it, and can be used as an essential oil to for aromatherapy, that type of thing. Just if you want, even if you want your house to smell good. I mean, because who doesn't like a citrus flavor or a citrus scent? Um, and in back in the day, it was used medicinally for some things, and it might even still be used for some things medicinally. But we're going to talk about that in just a second. So, and in a second, I mean like right now. So, the uses for bitter orange, there are a variety of things, and I mean there are many things that they have been thought that would be successful or effective in treating. However, all of these different things that I'm going to list, they have not been thorough studies. There has not been, something that says that it absolutely works. But because of what they found, the properties they found in bitter orange, the peel at least, and the fruit, you would think that they will work these ways, the way that they are. So theoretically, that's the word we're going for. Theoretically, bitter orange would be used for these things that I'm about to list. Now, allergic rhinitis, um, hay fever, and I'm going to list all these different things, but then I'll come back and tell you how bitter orange actually works, or how what they think is going to cause this thing to work this way. Androgenic alopecia, anxiety, Now, anxiety is not necessarily there have been studies that have been done, small studies that is that have been done, but that's not with the oral bitter orange. It's with the aromatherapy, so the essential oils of bitter orange. Athletic performance. This has actually been promoted in some products, but there is a plethora of other things: cancer, chronic kidney disease, conjunctivitis, constipation, diarrhea, fatigue, flatulence, frostbite, gallbladder disease, headache, hyperlipidemia or high cholesterol, peptic ulcers, pressure ulcers, which are your those are the pressure ulcers are the ulcers on your skin. Peptic ulcers are the ulcers in your stomach. Rheumatoid arthritis and rhinosinusitis. Now, that's a whole lot of things, and that's a whole lot of assumptions that they might actually work on these different things. And I will talk about a couple of other things as well, because we came into this particular topic based on people thinking that bitter orange works for obesity. And we'll get to that as well. That wasn't one of the ones I listed off top, but it has been known as a weight loss supplement or in combination with other weight loss supplements as well. So, how does it work? The fruit and peel contain adrenergic agonists, synephrine and octopamine. Now, I know that doesn't mean a whole lot to y'all, but those two ingredients are specifically one, synephrine. I don't know if you've ever heard the term synephrine, but it's actually in some of your medications, like the nasal decongestant neosynephrine. Neosynephrine is a nasal decongestant. So the peel contains synephrine, which is kind of like a product or cousin of synephrine. So synephrine is chemically similar to epinephrine. You know, we've always all heard of epinephrine. Epinephrine is the thing that you inject from an EpiPen whenever you're having an allergic reaction, and you jam yourself with the EpiPen in the thigh. That's epinephrine. So synephrine is chemically similar to epinephrine, and octopamine is similar to norepinephrine. So both of these naturally occur in the body. Now, with that being said, this is why there's all the hype about whether or not bitter orange can help with all these different things, because chemically it looks like things that actually work in the medical industry, like epinephrine and norepinephrine. They're similar to it. So why not think that it would actually work the same way, right? So it acts similar to phenylephrine, the nasal decongestant. Anybody remember when pseudoephedrine was on the market? Well, it still is on the market, but it was over the counters, I should say. And you didn't have to show your driver's license to get anything that was pseudoephedrine. Now you do. When what happened when pseudoephedrine went behind the counter and you had to sign for it? There's another nasal decongestant called phenylephrine that went over the counter that you don't have to sign for. So the properties in bitter orange are similar to that ingredient, phenylephrine. If I lost you, I'm sorry. It gets a little a little technical at times, but just keep that in mind. Um, Now, a couple of other uses, and I'll kind of tell you why they think this works for this. So diabetes. So there was a small study that showed that drinking tea made of fruit of bitter orange for 4 months decreased the fasting glucose. Now, there wasn't enough data to really support it and just push it on out there and say, hey, you drink bitter tea, bitter orange tea, and it'll decrease your fasting glucose. But this was a small study over 4 months. I would actually take that into account as, yeah, that might actually do some good. Um, if you've seen it work over 4 months, it just depends on what they consider to be small, how many patients were in this study. The data that I was reading, it didn't really say how many patients were in there, but small typically means in medical terminology insignificant, or not enough to really, push it on out there and say, yep, this really works for that. So I would say that there's been more studies that are happening, and you have to keep into account that these studies that happen, they're not studies that are being done by FDA, but they're studies that are being done by third parties who want to find out if this actually works. Now, another one is obesity, and I kind of mentioned it a little bit earlier. The effects of bitter orange alone are unclear. So, bitter orange by itself, if you had to take the supplement, is very unclear as to whether or not it would help with obesity or weight loss. But combined with other products such as caffeine, showed improvement in body weight, and but that also included a combination of exercise and diet restriction or caloric restriction. So alone, bitter orange has not been shown to have any effect on um, weight loss. However, in combination with other products, as well as diet and exercise, it actually has shown to, help just a little bit. Now, P-synephrine, which is like a cousin of synephrine, is structurally similar to ephedra. If you are a little bit older, you might remember ephedra being on the shelf. Um, there were products that were marketed and they were taken off the market because there were risks associated with the heart, with cardiovascular events happening. So that was taken off the market. And anything, let me just say this real quick, anything that is going to speed up your metabolism is in turn speeding up your heart rate, which in turn may cause an issue for you cardiovascular wise, just depending on what it is, how much you're taking. When you overdo some of these weight loss supplements, you have to realize that those weight loss supplements sometimes speed up your metabolism, and that has an effect on your heart. So please be careful of those. Please be careful of those products that are on the market. I've heard some people talking about having, palpitations and things like that after taking some of the supplements that are available over the counter. Um, so just be mindful of what you're taking. Please always clear with your doctor, especially if you are a person that has high blood pressure, high cholesterol, you've had a stroke before, you've had a heart attack before, anything that you have, cardiac disease, anything that's going on with your heart, please, please, please clear it with your doctor before you take any type of supplement over the counter. I'm even talking about these teas that are produced that supposedly help you to burn, you know, to burn fat or, increase your metabolism. So just be mindful of that when you are, taking these supplements. It's just, you have to be mindful. Now, bitter orange was promoted more after the product ephedra was taken off of the market. Bitter orange was promoted a little bit more for weight loss because, one, it wasn't taken off the market. Two, it's chemically similar to the thing that was on the market, which is ephedra. Now, bitter orange oil has been used in aromatherapy for anxiety and insomnia, and studies are unclear as to its effectiveness, but it is thought that the aromatherapy actually helps to relax or calm, even to the point of helping you fall asleep, hence anxiety and insomnia. Now, is this product safe? Pretty much. Safe in amounts commonly found in your foods. If you don't overdo it, just as with anything else, it is pretty safe. Again, remember the ingredients that are in bitter orange, the things that are found chemically that are found in bitter orange are actually a part of your body already. But when you take something in, when you take something by mouth, or you drink a tea or anything of that sort, anything that you add to the body can have an effect on the body, even if you're increasing what's already in the body. So just keep that in mind. Marketed products used for medicinal purposes are unsafe in pregnancy and lactation. So my pregnant mamas and those who are breastfeeding, please don't do supplement with bitter orange for any purpose, even if it is the aromatherapy portion of it. You want to stay clear of bitter orange because they do have those, you know, they do have those side effects that come from even the aromatherapy of it all. Speaking of side effects, so hypertension, tachycardia are going to be the two things that can develop from long term use of bitter orange. And also, especially if you partner it with other weight loss products like caffeine supplements or green tea extract, anything that boosts your metabolism, it can increase your blood pressure and can cause tachycardia, which is an increased heart rate. Um, let's see. Let's next thing, skin irritation. So it's bitter orange has been used topically sometimes, and it can cause skin irritation when being used topically. Now, this is important. If you are taking bitter orange by mouth and you go on a drug screen for a new job, it can cause a false positive showing amphetamine in your system. Why? Because synephrine is closely related to amphetamine. Um, so if you are taking bitter orange orally, you can flag on a drug screen for a positive amphetamine, a false positive for amphetamine. Just keep that in mind. Many people might not have known that. That's something that you probably wouldn't think of. You're thinking you're taking something that's over the counter, that's a supplement that's perfectly healthy. And because it's over the counter, but these are the things that I come to tell you so that you would be aware of. If you're taking this, you do a drug screen, it can cause a false positive for amphetamine. Now, drug interactions. Whew, this is a lot. Drug interactions with um, bitter orange can happen. So with caffeine, and I kind of stated it before, caffeine has been paired with bitter orange for weight loss supplements, but it can also increase your blood pressure and heart rate when doing so. um, Bitter orange can increase the levels of dextromethorphan. Dextromethorphan is the cough suppressant that's found in a lot of cough products. If you have a dry cough, Mucinex DM in that combination of Mucinex DM is dextromethorphan. So it can increase the levels of dextromethorphan. It can affect your colchicine levels. So if you're a person that's taking colchicine for gout, it can increase those levels. If it can increase felodipine levels, felodipine is an antihypertensive or medication for blood pressure. It can increase those levels. It can increase indinavir levels. That is a medication that is used for treating HIV/AIDS. It can increase midazolam levels. Now, midazolam is a sedative. That's not something that you want to combine. However, I rarely see midazolam given outside, given in the pharmacy on a daily basis. It is used to stop seizures as well. Um, but it's not something that I've seen like just overly used. Um, So that's just putting that out there. It can increase monoamine oxidase inhibitors, or what we would call MAOIs. Now, An MAOI is an antidepressant medication. If you're taking it, you would know what it is. If even if you're taking it, you might not know what it is. But parnate, and selegiline are MAOIs. So parnate and selegiline, if you are taking those two medications, or one of those medications, you do not want to take bitter orange. It can increase those levels uh, of that. Sildenafil, that's another one. It can increase the levels of that. And with any stimulant, so anytime you're taking a stimulant, like any type of amphetamine, your ADHD products, your Vyvanse, Adderall, things like that, it can increase blood pressure and cause cardiovascular events. So if you are on any type of stimulant, Vyvanse, Focalin, Adderall XR, Concerta, any of those, and the list does go on. If you're on any of those products, my suggestion is to stay away from bitter orange. It can cause more harm than help. Interactions with conditions. If you get headaches. If you get headaches, it can trigger more headaches. If you get migraines, you want to stay away from bitter orange. It can increase your headaches. If you are already a hypertensive patient, if you are being treated for high blood pressure, it can increase your high blood pressure and increase your blood pressure and make it worse. If you are being treated for narrow angle glaucoma, if you are an older person who has glaucoma, typically is in older people. I'm not saying that it can't be in the younger ones, but typically in the older ones. If you are being treated for narrow angle glaucoma, it can worsen that. All right. So that actually is the end of the information on bitter orange. Now, I will say this. If you didn't know about bitter orange, you know a little bit more about it now. That's the first thing. Second thing is, please just be mindful of the supplements that you are using on a daily basis. Please see your pharmacist or doctor if you want to take any supplement in addition to medications that you are currently taking. Do not, do it without letting your physician or your pharmacist know. They can guide you as to what can be taken and what cannot be taken. Please ask questions. Please ask as many questions as you possibly can concerning any supplement that you decide to, or that you're interested in for taking, that is over the counter. As you can see with bitter orange, there are lots of interactions and there are things that can happen to your heart when you're taking it in combination with other products. And it can be more harmful than what it is helpful. So I'm going to, say just be mindful of anything that you take in, just in general, be mindful. And don't just take things without doing the research first. And don't go off of the next person's information because your body is totally different from their body. And you don't know how you're going to react. Something might work well for one person, but not work well for you. So that's why we say, please talk to your doctor or pharmacist before taking supplements. That's my TED Talk for today. I want to thank you for watching. I want to thank you for tuning in during this time. I know sometimes it can be a little lengthy, sometimes it's a little shorter, but I want to make sure that you are aware of those things that are out there. And because there's a lot of different supplements over the counter, y'all, and a lot of people don't know about them. So I want to make sure that you're aware of what you are taking into your body. With that being said, please do me a favor of like, tagging, and sharing. Please follow me on all of my social media platforms. That would be TikTok. Rarely on there. I need to do better, but I'm going to get better at being on TikTok a little bit more. You can definitely check me out on Instagram, Facebook, of course, where I'm streaming from today. I do have my Facebook business page. I have Instagram. TikTok, and then also a YouTube channel. If you would subscribe there as well, you would get the alerts for when I'm going live. And then the handles for all of those are going to be Dr. Raven PharmD. Now, you can also check out my website at www.drravenformd.com and check out the stuff that I have on that website. I have some merchandise that's available, and I also have some books that are available. If you didn't know, I have written two books, and one of them is called The Do's and Don'ts of Earning Your First Six Figures. These are guides for my graduating pharmacists, but actually it's a guide for anyone who is graduating college. It's a, kind of some things to remember, some things that were never talked about. My learning experiences, very short read, but you can check that out. You can either message me to get a copy signed, or you can order them on Amazon. They are still available on Amazon. And then also, I have The Girl Who Wore Her Heart on Her Back. This is kind of a personal thing for me about emotions, and um, is kind of more my story along with how I dealt with emotions over the years. Um, this is a picture of me on the book. If you didn't know, that is my back and my scar. And this was something that took a lot for me to do because I really don't show my scar um, as much. So check this book out. You can get a copy from me as well on the website, or you can get a copy on Amazon. If you want an autograph copy, check it out on my website, and I'll sign it for you, leave you a note, and so forth and so on. Thank you so much for your support. Thank you for all the things that you are doing, that you have done in supporting me as far as tuning in for this past year. It's been a little over a year, and I appreciate every person that has watched, every person that has shared, and I'm going to keep on pressing on. So hope y'all have a great day. Make it